Yep. Yep.
Hello everyone, my name is Rulennis Munoz. I am here with People's First PA. I am Ricardo Munoz's sister. He was shot and killed by Lancaster City Police 2 years ago today while suffering through a mental health crisis. I am a graduate LPN, a certified phlebotomist. I have also worked as a home health care worker, and I am continuing my healthcare education. I believe healthcare is a human right, and that's why I got into the healthcare field. Healthcare to me is about helping and providing with care what they need. It is about making them happy, healthy, so they can live to their full potential.
That's right.
Since my brother Ricardo was young, he suffered from developmental challenges and faced a lot of bullying, which caused him trauma. Ricardo was diagnosed with schizophrenia in his 20s. All throughout Ricardo's life, our family didn't get the support we needed to navigate the healthcare system, nor were we made aware of the different services that were available for someone with his special needs. My brother Ricardo was a Medicaid recipient, and following his diagnosis of schizophrenia, we feel he didn't have the proper support from the healthcare system. Why wasn't he given an intensive care manager the moment he was diagnosed? Why does Lancaster, PA only have limited mental health services? And even though my community is limited in services, we are still losing more healthcare services. We lost St. Joseph's Hospital early in 2019 when the University of Pittsburgh Medical Center decided to close the hospital because they felt it wasn't profitable enough, despite the fact the hospital was and is in need in our community. Ricardo lived just 7 blocks away from St. Joseph's Hospital, and when UPMC closed the hospital, that limited where we could take Ricardo for care when he was in crisis. We had to take him away to Lebanon a few times for the crisis care, which is at least an hour away, because that was the closest crisis center, just for him to be triaged and sent home without receiving the proper care. He was once picked up by police and taken to LGH emergency room, and on that night they released him shortly after arriving at the hospital, and he was wandering around the city for several hours. The mental health care received by Penn Medicine is inadequate, to say the least. March 2019, the first full month St. Joe's Hospital was closed, the emergency room walk rose from an average of 59 per month to 308 in a month of March alone. The accidental death rate in Lancaster County nearly doubled because ambulances, diversions, and Penn Medicine also being severely over capacity. About a week before Ricardo was shot and killed by Lancaster City Police, the City Council voted in favor of UPMC, rezoning petition, and sealing the fate of St. Joseph Hospital. On September 13, 2020, Ricardo was experiencing a mental health crisis. I had called crisis intervention in Lebanon. They told me to call the police, and most likely my brother will be arrested. After that, I called the non-emergency number to ask what the proper procedure was, and they told me to call crisis intervention back. As I was doing that, the police arrived. Within moments, my brother was shot and killed by Lancaster City Police. Protests ensued following the police shooting of my brother, and the mayor spoke at the press conference the following day, talking about half Lancaster City being poor and the loss of mental health care services. But nowhere in her remarks or those of the city council members did we hear about their role in the loss of mental health care services in our community. Our family can't help but wonder, will Ricardo be alive today if St. Joseph Hospital was still open? How many of the 1,958 people in Lancaster County who died of COVID-19 will still be alive? We need to put a stop to hospital closures and the stripping away of healthcare services, especially mentally healthcare services. And we need to put an end to criminalizing poor people, people of color, people with mental health issues, and people with special needs.
Yes.
We are here today to demand our human right to health care.
Yes.
Yes.
Thank you.
Yes.
That was fantastic.